state your name for us, please? First and last, spell it, and your title here at Prisma Health.
Yeah, I'm Dr. Armin Meyer, A-R-M-I-N. Last name is M-E-Y-E-R, and I'm a pulmonary and critical care physician in the Department of Internal Medicine at Greenville Memorial Hospital.
Tell us a little bit about, you're talking about vaping and why it's bad.
Yeah, well, recently there have been a number of cases nationwide. We have well over 100 cases associated with vaping of acute lung problems. And as of today, there have been 7 reported deaths that are associated with vaping use. Here in the upstate, we've had a number of cases as well. I've been involved in the care of over 6 patients. Of these, at least 3 were critically ill, requiring ICU care and ventilator support. This is quite an alarming new development, and there are a lot of questions surrounding this, but it is important to understand that while we have been researching smoking for many, many years, vaping is a relatively new kid on the block, which previously was felt to be potentially safe, but this really raises questions as to whether vaping is something that can be recommended at all.
And talk about a little bit why it was another alternative to try to make smoking quote unquote safer. So talk about why this has become an issue now with health concerns, especially I guess really amongst young adults as well, really using the vaping.
Yeah, everyone is well aware of the health risks associated with smoking. That has been researched over years and years, and we know that in the long term, cancer and lung disease can come out of it. And vaping has lately been marketed, particularly to the younger people, as a safe alternative to smoking. And initially, a number of health providers were also thinking that it might be a good way to let people have their nicotine without the health damage associated with this. And now we have to understand that this is probably a big mistake.
What are some, recommendations for those who might be vaping or who might be using these techniques to smoke? I mean, of course, you say stop doing it altogether, but of course, people might not want to do that. So what are some alternatives? What are some kind of feedback or suggestions you can give those who are involved in this?
Well, unfortunately, I can't give any alternative to not vaping. At this point, we do not know if it is safe. We do not know if in the long run we might be dealing with an even larger health crisis than actual tobacco smoking. So we cannot give any good alternatives to not vaping. We do know that there are different substances involved, nicotine, but also THC. So we can't assume that vaping is any safe way of delivering any of these drugs. And the fact that many of these companies market to the youth with flavors and cool gadgets, that is what is particularly alarming, that so many young people are actually starting this with the misunderstanding that it may be a safe alternative.
Is there anything else important that might be missing out about this case or ownership?
Yeah, I think it is important to have an understanding of what the acute side effects can be. And we do have patients who cannot breathe, who have low oxygen levels, and actually have to be on artificial life support for this. Other symptoms include non-specific ones, fevers, chills, GI symptoms, general unwellness. So what one might think is a case of a cold can actually be vaping-induced lung injury.
One more time, physician name.
Armin Meyer,